Once the COVID vaccine is delivered, what happens inside the hospital? Frank Holland, I got to look now, or how one hospital is preparing to administer hundreds of vaccinations daily. We wish him well, and Godspeed, Frank.
I think luck is definitely a component, Joe. We visited University Hospital in Newark, New Jersey. It's a site that hopes to be one of the first in the nation to administer doses of Pfizer's COVID-19 vaccine. That could happen possibly as early as Monday. Preparations are underway right now to vaccinate as many as 600 people a day. The hospital's 1,000 frontline workers, they have the option, it's not mandatory, they have the option to get Pfizer's vaccine as part of this pilot program, testing the initial logistics of how to safely inoculate large numbers of people in a single location. University Hospital has set up what they call an assembly line. It has 4 steps. It's patient registration, a quick health check, the vaccine is then given, and the patient's then monitored for 15 minutes. The CEO of University Hospital, Dr. Elnahal, says the need to keep Pfizer's vaccine super cold and use it all once it's thawed out are just a few of the complications in this particular vaccine process.
We have a responsibility to communicate not only what's going well, but things that may not be working and changes we have to make in real time. The concept is continuous improvement. We have to move fast. The science moved fast. Everybody moved fast to try to get us here. It's our responsibility to vaccinate as many people as possible fast, but also to learn throughout that process and communicate that learning to everybody.
And the hospital will inform Operation Warp Speed about any issues. It also surveyed its own workers and found only about half of them are willing to get the vaccine right now. Dr. Elnahal says convincing the staff is a key step in convincing the general public that this vaccine is safe and effective. Back over to you.
Those numbers are always surprising to me with healthcare workers that are so exposed. And it's just, what do you attribute it to, Frank? I guess the controversy that always swirls around vaccines that has even been, the rhetoric in the past 6 months. We've seen, political motivation for talking about it one way or another, but more than half aren't hospital workers not convinced to get the vaccine. You got any on you, Mac?
To be clear, Joe, half said they would get it.
I would take it right now.
Just to be clear, half said they would get it right now. Right, half said they would do it right now. A quarter wanted more information, and a quarter said no. And Dr. Elnahal said he believed that kind of reflected the general sentiment in the overall healthcare community. Health workers, like many of us, have questions about the speed in which this vaccine was brought and also possibly its side effects.
Which there don't seem to be very many, except for the same as like a flu vaccine. Beck has a question.
Yeah, I know this debate is always out there about whether people should be forced to get the vaccine. And that's a question that makes sense to me at some point next year. I just feel like right now there's so many more people who want this vaccine than who are going to be able to get it, at least right out of the gate, that, OK, if you don't want it, step aside. Let somebody in line behind you get it, and then we'll deal with protecting broader workforces when this is more available.
Becky, we spoke to the CEO about that. He said, in general, that's why they're not forcing anybody. It's not mandatory because they want people to do it on their own. But ideally, 70% or more of the staff would get the vaccine in order to really reduce the risk of transmission. That was his figure. But again, they're not making it mandatory just because of some of the concerns that a lot of people have. Also, Newark is in a majority-minority community. He says a lot of people in the minority community are especially skeptical, and they're really trying to do a lot of outreach to reduce those concerns or at least address them.
Shepard Smith here. Thanks for watching CNBC on YouTube.